You might be wondering why you have this light on your finger when you stay in the hospital overnight after surgery. Let me show you the importance of this and other commonly used monitors. My name is Max Feinstein and I'm an anesthesiologist with the Anesthesia Patient Safety Foundation. In this video, I highlight how a class of medications called opioids is frequently used to keep patients safe and comfortable during and after surgery. Opioids that are commonly prescribed by healthcare professionals include oxycodone, fentanyl, and hydromorphone, which is also called Dilaudid. When given by healthcare professionals in a monitored setting like a hospital, opioids are very effective at providing pain relief before, during, or after surgery. These medications help keep the heart rate and blood pressure in a safe range during surgery and are frequently an important part of the anesthesia medications that patients receive. After surgery, pain management from opioids can help patients get rest and get out of bed. Your doctors typically like to administer multiple types of medications to help with pain, and opioids can be one of these medications. This is often referred to as a multimodal pain regimen, since the medications target different types of pain. In many cases, we only prescribe opioids when surgical pain is worse than what can be alleviated by our standard pain medications, such as acetaminophen and ibuprofen. As with almost any class of medications, opioids can have unwanted side effects that include nausea, constipation, itching, serious breathing problems, and addiction to the medications themselves. If opioids are overused, patients can become tolerant, meaning that the medications don't provide the same useful effect over time. Opioids like fentanyl have recently made headlines for the dangers that are associated with overdosing or taking too much. But when opioids are administered by healthcare professionals, there are many ways that we keep patients safe. In the operating room and after surgery, patients are closely monitored with equipment that measures breathing. For example, the respiratory rate and the amount of carbon dioxide that a person is breathing off. We also continuously measure how much oxygen is in the blood with this device called a pulse oximeter, or pulse ox for short. These monitors help us detect any breathing problems early, before anything bad happens to a patient. If a patient does have serious side effects from opioids, they can be quickly reversed with a medication called naloxone, or Narcan. This can be administered through an IV as well as through a nose spray, which is available over the counter in many places. In conclusion, healthcare professionals frequently rely on opioids to keep patients safe and comfortable around the time of surgery. Like any medications, they can have serious side effects, but are generally quite safe when administered under the supervision of a healthcare professional. Don't hesitate to ask your anesthesia professional whether they plan on administering opioids during or after your procedure.